Yeah. Carla. This is obviously horrendous. It's horrendous for all of the families involved. It's a horrendous failure by the state. I have a series of detailed questions I'm going to ask later on to the Minister. But for now, I just want to put some things on the record, because various people are asking questions about things and so on, and I happen to know the answer of some of them. So, for example, there were 3 springs used. One caused severe damage to a child's pelvis and rib cage, requiring multiple operations. One broke a few ribs, and one is still in a patient having broken and may have corroded as a result of not being made of titanium as the appropriate metal. In March, pressure was put on surgeons to restart this surgery by CHI management, despite the fact that they knew about the high level of complications and despite the fact that, tragically, one child had died. That is the case. I have a parliamentary question answer from Children's Health Ireland, which denies that's the case. It says Children's Health Ireland is not aware of any internal or external pressures on clinical staff to restart kyphectomy surgeries, but that is not accurate. I've been pursuing this issue since April with a whole series of parliamentary questions. And one of the troubling things, which is a question about governance of Children's Health Ireland, is that I repeatedly received inaccurate, wrong answers from Children's Health Ireland. So when I asked first about the issue of unlicensed implants being used in surgeries in Temple Street, the answer I received then from CHI was to say that to the best of their knowledge, which struck me as strange when I got the answer that they had that kind of qualification in, but to the best of our knowledge, everything is appropriately CE licensed and so on. I went back to the person who had made this allegation to me, which I didn't know whether it was accurate or not, and asked again. They said, yes, definitely the case. I went again, and I got another answer then, this time in late June, I think, whereby to the best of our knowledge was gone, but again restated that this was not the case. Right? But it clearly was the case. It's now accepted that it was the case. So we have a very significant problem there where parliamentary questions are being answered wrongly. I'm going to pursue with the Minister later, and he presumes expecting it, the question of when the Minister knew about it, because obviously the line is that the Minister, the Department, only knew about it in August. But on the 13th of July, I mean, if it wasn't clear from the questions in May and in June, on the 13th of July, I put in a series of questions which kind of left the Minister in no doubt whatsoever, asking how many spring implants have been used in Temple Street Hospital for spinal surgery in patients with spinal muscular atrophy and spina bifida, how many have been removed, how many have been failed in situ, whether the CE marked, a series of questions. So at the very least, by the 13th of July, the Minister was aware about it, and the question is going to arise for the Minister, what did he do about it? What did he do about it in the intervening period? And throughout all of this, and just finish on this, there's kind of given the impression that as a flowing on thing from the last external review, this new external review would have been called. That was not going to happen. The only reason we're here now, the only reason this isn't still happening is because of whistleblower and because of the articles we've seen on the ditch.
Thank you very much.